Hello there, this is Dr. Yasin Tayem, MD, PhD at the Arabian Gulf University, College of Medicine and Medical Sciences. In this video, I'm going to talk about problem number 1 in Unit 2, antiviral drugs. This week's problem was about a child who presented with stridor and was diagnosed to have viral croup. This resource aims to introduce the basic and clinical pharmacology of the major antiviral drugs, viral life cycle, and common viral infections. Viruses are obligate intercellular parasites, which means that their survival and replication depend on being inside host cells. Viruses replicate their genetic material using host DNA enzymes. Then they use a host enzyme to exit the cell to infect another one. Viral infections are extremely common. In certain body systems, the most common cause of an infection is viral. Examples include upper respiratory tract and GI tract. Viral life cycle. Virus attaches and enters cell, then uncoats, which means that its genetic material is released. Host DNA polymerase duplicates viral DNA. Structural and functional proteins are formed on host ribosomes. Viral assembly takes place, and young viruses, which are called virions, are released from the cell to infect another cell. Introduction to antiviral drugs. Why are most antiviral drugs toxic? To stop viruses, antiviral drugs must either block viral entry into or exit from the host cell, or enter the host cell to inhibit the virus. Since these drugs may enter host cell, they result in toxicity. Antiviral drugs are active only against replicating viruses and do not affect latent viruses. In most cases, antiviral drugs do not result in viral eradication. Rather, the latent virus will stay inactive in the host cell and may get reactivated in the future if immunity gets weak, such as in old age or AIDS. Herpes infections and anti-herpes drugs. Herpes simplex virus causes oral and genital herpes and encephalitis. Varicella zoster virus causes shingles in adults and chickenpox in children. Acyclovir, valacyclovir, and famciclovir are the available anti-herpes drugs. What is the mechanism of action of anti-herpes drugs? These drugs require 3 phosphorylations for activation. The first one is by the virus enzymes and the rest are by host enzymes. The triphosphate form of the drug inhibits viral DNA replication by 2 mechanisms. First, stopping DNA polymerase, and second, incorporation into the DNA of the virus, causing chain termination. What are the adverse effects of anti-herpes drugs? These drugs are generally well tolerated. They can cause nausea, diarrhea, and headache. The problems start on IV infusion, which can result in irreversible renal or CNS toxicity. But these are prevented by adequate hydration, avoidance of rapid infusion, and avoidance of concurrent use of nephrotoxic drugs. Valacyclovir is rapidly converted to acyclovir, but has higher bioavailability. Famciclovir, the mechanism of action is like acyclovir, but it does not cause chain termination in the virus. Trifluridine is another anti-herpes drug. It is effective in treating keratoconjunctivitis and recurrent keratitis due to herpes simplex viruses and for treatment of acyclovir-resistant herpes infections. CMV infections and anti-CMV drugs. CMV infections occur in advanced immunosuppression, such as AIDS, due to reactivation of a latent virus, and results in very serious retinitis, colitis, esophagitis, encephalitis, and pneumonitis. There are 4 available anti-CMV drugs, which are valganciclovir, which is a drug of choice, ganciclovir, foscarnet, and cidofovir. The mechanism of action of anti-CMV drugs is exactly the same as acyclovir. However, cidofovir is phosphorylated by host enzymes only, while foscarnet needs no phosphorylation. Otherwise, the mechanism of action is the same as acyclovir. Ganciclovir and valganciclovir are used for retinitis, colitis, esophagitis, encephalitis, and pneumonitis. However, for retinitis, the best is to use a combination of ganciclovir and foscarnet. The major adverse effects of ganciclovir include bone marrow suppression, which is the most important, and other toxicities like CNS toxicity, GI tract toxicity, and hepatotoxicity. The main adverse effect of foscarnet and cidofovir is nephrotoxicity. It is prevented with good hydration, slow infusion, and avoidance of administering other nephrotoxic drugs at the same time.